Historic new health legislation, now the law of the land right here in Georgia. This is going to be giving people access to much needed medical treatment, and it'll also make it a little easier to build hospitals and health centers all across our state. WPGA News Macon political reporter Doug Reardon explains.
That affects me as a provider because I want as much access as possible for all my patients. I want them to have choices.
And right now, Dr. Cecil Bennett says his patients don't have as much choice as they should when it comes to where they get their health care.
It's just not fair. In a country as rich as our country is, in a state like Georgia, patients should be able to access care much more easily.
Part of that problem was fixed this week. Since the 1970s in Georgia, if you wanted to build a hospital or a health center anywhere in the state, you had to have what's called a certificate of need.
There has to be enough documentation that that facility is actually needed in that particular community.
With the stroke of his pen on Friday, Governor Brian Kemp eased regulations so hospitals could be built with less red tape. And it's not just hospitals. The bill also makes it easier to build psychiatric, substance abuse, prenatal, and outpatient centers.
These projects will help meet one of the greatest needs facing our state, and that is our healthcare industry, having a well-trained, capable healthcare workforce.
Certificate of Need was originally meant to make sure unnecessary construction didn't happen, passing the cost on to local residents. But with shrinking healthcare options in Metro Atlanta, this is a welcome change to many providers like Dr. Bennett, who are constantly referring patients to bigger or more specialized facilities.
I want there to be choice, that basically the more competition, I believe the better care my patients will get.
And that was Doug Reardon reporting.